Well, hello. I'm Dr. Shelley of Shelley's Nursing Review, and today's lecture is all about cardio. So there will be several sections for this lecture. You'll have a video on acute coronary syndrome, another one on pathophysiology. You'll have another video talking about medications, other videos talking about EKGs. This is a series, of course, because cardio is so massive, right? The heart conditions are so massive. And so what I want to point out to the student, although you don't have to be a student to learn from this video, what I want to point out to the student who's enrolled in my NCLEX review program, that you should have your materials out and ready to roll. Let me just point out and remind you what packets you should have out. The pink packets are huge. You know that these are necessary for the test. The Oh My God packet is one packet you should always have out for every video I do. The procedures packet is huge because it's all procedures. And then of course we have our medication categories. You know that if you open this packet, this is the easiest way to learn your medications because I put them in the categories. The whole OL, prills, and all that are right in there, okay? Your diuretics, everything. And then if you look, you have another pharmacology packet. This is your quickest reference during a video because if I write a med on that board or if I say a medication, this is all alphabetical order. You can grab it and highlight it. Then of course, this is cardio. So the cardio packet is critical. And I'm going right in order. That's how this lecture goes. I just go right in order. So for example, if you notice, there is a picture of the heart in this packet. And I'm going to be talking about physiology, and this heart is really showing you how the blood is flowing. But I'm going to be talking and you're going to kind of be looking at the structures and go, oh, she just said that. Okay, so that's how you do it. Now, of course, any good student always has highlighters. They don't drop them like I did, but they always have highlighters and colored pens because I'm going to tell you when to highlight, when to put a little star by something, when to do this and that that's going to maybe highlight what's on certain exams that you'll be taking. The student who is taking a final exam in the nursing school or the student who's actually taking the NCLEX exam will find this to be everything they need to pass. Let's get started. Now, so I'm going to start with the pathophysiology of the heart. And the best example I can use is probably your grandmother. Now, in our culture, the African American culture, we usually say Big Mama. And so we're going to start right here with Big Mama. If you think of the heart as a right and left organ in one, you have to start to separate in your mind what happens on the right side versus the left side of the heart. So let's start with Big Mama's ankles. You go over your grandmother's house, you notice her ankles are completely swollen. And you say to her what you know, and that is, oh, Big Mama, you need to put your legs up so that the swelling can go down. You need to put your legs up on some pillows so all that can go down because that's not good with the way your legs are swollen. And also, Big Mama, I saw you were eating soup, and soup is so salty, and part of the reason why your ankles are swollen is that salt makes you retain water, and it goes all the way down to your ankles. Now, let's put some physiology behind it. Let's put the pathophysiology behind what you told your grandmother. What happens with the heart, the right side of the heart? It's supposed to collect blood from the toes and the nose, which means head to toe, all the blood in your body is supposed to come in through the right side of the heart, through the biggest vein in the body. So in the right side of the heart, we think of it as the venous side of the heart, or veins. And the blood is going to come up from Big Mama's ankles once you told her to help it with gravity. It's going to come up from her ankles all the way uphill. That's why gravity actually helps. If you put her ankles up, the blood can easily go back down. So it'll come up through her legs, her thighs, her groin, her torso, all the way up through the vena cava. Think of the vena cava as an elevator. The vena cava is up and down. It collects blood, people on the elevator, from up, and it collects blood, people on the elevator, from down. So it can go up to the heart or it can go down to the heart, but it's one long, huge blood vessel. Now, so you told her to elevate her legs. She did. The blood from the veins in her legs went straight into the heart through the biggest vein in the body, the vena cava. When it entered the vena cava, either from her legs or her head, her shoulders, wherever, if it entered the vena cava, it's got one more place to go. It's going to go into this right atrium. Now, you know all about atria. You know they're the top of the heart. The ventricles are the bottom of the heart. Well, in the atria, I want you to think about it as a party down the way. Now, I used to party. I'm not going to lie to you. Things was a little different back then. You didn't get shot up at the club. No, you had fun. So I had my favorite club, and if you right here in Cleveland, you know what I'm going to say. It was called The Reasons Why. And in The Reasons Why, you walked in this club in Shaker Heights, and the top part of the club was all about chilling and feeling. So what do I mean chilling and feeling? I mean that the top part of your heart, the atria, are chilling and filling. They're filling up with blood. They're meant to fill up with enough blood to push down to the ventricles, and that's a whole nother part of the party. So if we think of chilling and filling, and what were you doing in the club? You were chilling and filling. You were filling up with alcohol. You were chilling with your friends, especially your girls, and then probably filling up your purse with some phone numbers. Well, think about that. That's the top of the heart. The top of the heart is filling up with blood, and it's waiting until it's full enough to push it down to the ventricles. Now, let's go back to the party. If this blood entered the vena cava, went into the right atria, there's a couple of valves in there. Think of them as the bar. Yeah. So the valves in the atria, I want you to say to yourself, try it before I buy it. Try it means that at the top of the heart in the atria is the tricuspid valve. Try it before you buy it. And the bicuspid is on the other side of the heart. That's why I said try it before you buy it. So the heart has a tricuspid valve. The blood is entered through the vena cava to the right atria to the tricuspid valve, and it's headed down to the ventricles. Now, the ventricles of the heart, both of the ventricles of the heart. That is the basement of the party. Now, don't act brand new. You know what the basement of the party is all about. That's where you pumping and bumping and flashlight. I'm sorry. I just go back every now and then to the party, and I have to stay focused. This is a cardiac lecture. But you already know what was going on in that basement. It was hot. It was crowded. It was crazy. Music was loud. Everything was going on. People were dancing. They were pumping it up. I mean, it was gone. Well, that's exactly what's happening in the ventricles of your heart. In the ventricles of your heart, there is massive pumping. No, not like the atria, not little chilling and filling, which was called diastole on the blood pressure. This is the ventricles. This is a big deal. They are pumping a massive amount of blood to another part of the body. Now, on the right side, this ventricle is pumping a massive amount of blood to your lungs. So if you think about it like this, you have vena cava, right atria, right ventricle. And then the big part, lungs. Boom. Let's talk about those lungs. When the blood is pumped from the right ventricle to the lungs, it must go through the pulmonary artery. It has to. When it goes through the pulmonary artery, it is going to enter a part of the lungs called the alveoli. Now, you got to think about what just happened. The blood came from all over your body. It had no oxygen in it. It was called venous return and venous blood because it came from all the veins throughout your entire body into the biggest vein of the body, which is the vena cava. It entered the right atria where the chilling and filling was going on. Things were mellow, jello, diastole, or the lower number of the blood pressure. Or if you want to think of an EKG, the small moon-shaped hump, P wave, before all kinds of crazy happens. Okay, so EKG, P wave, blood pressure, lower diastole number, atria. Move to the ventricles through the tricuspid valve, going straight to the ventricles, bigger part of the heart, bigger pump, higher pressure, going from the ventricles over to the lungs. Now this right ventricle, when it goes and it pumps blood into the lungs, it has a purpose. There is what I would call, if you look at my hands, a gas exchange. A gas exchange is occurring in the lungs. CO2 is being dropped off and oxygen is being picked up. So you done got rid of that carbon dioxide and you done picked up that oxygen, and now we are ready to make another move. Now, where did this happen at in the lungs? We can't just say lungs. We're not kindergartners. No, 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 no. We are nurses. This happened in the alveoli. In the alveoli, which are the tiniest sacs in the lungs, this gas exchange is taking place. There's just one problem. There's just one problem with that thought process. Lots of things can affect those alveoli. Let's talk about some things that could affect that alveoli. If the alveoli's tiny sacs have collapsed, then there's not going to be a lot of gas exchange going on. And when, Shelly, do they collapse? When do they close? When do they shut down? Well, they can shut down after surgery if you're not doing this. Coughing and deep breathing. Because you see, coughing and deep breathing keeps the alveoli open and allows for the gas exchange and oxygenation. Is there any other time they could collapse, Shelly? Oh, you bet they could. They could collapse with ARDS. That atelectasis that I mentioned could happen in ARDS. That collapse of the alveoli can happen with acute respiratory distress or ARDS. If that happens with ARDS, all bets are off because that is a very severe, deadly disease condition, if you will. And what happens with ARDS? Oh, you better know. If I give the ARDS patient some oxygen, that oxygen is not coming back up. Oh, no, no, no. Their oxygen could be 80% and I give them oxygen, it didn't budge. That is a classic hallmark sign of ARDS. You know that. But I'm just talking about side notes, okay? Let's go on back to this Big Mama's heart. You get back to Big Mama's heart. We go ahead, we pump the blood from the atria to the ventricle, from the ventricle to the lungs. In the lungs, we're in the alveoli. We dropped off the CO2, we picked up the O2. We on the move. We've got to get out of these lungs though. So now we need to think, I've got my oxygen, where do I go now? Well, I need to get over to the left side of the heart, which has a completely different function. See, the right side of the heart, R for right side, R for receive the blood, V for veins, and V for volume. There's a large volume of blood coming in from the entire body into that left side of the heart. And that volume of fluid, sometimes called preload, is going to be a big deal later. And so this whole right side of the heart has done its job. You helped it a little bit when you elevated Big Mama's ankles, because why did you even have to do that? Why don't I have to elevate my ankles at the end of the day? Why did we use Big Mama as an example? Why at 20 years old aren't you elevating your ankles since gravity makes everything better? Well, because The purpose of elevating the ankles in the elder person, the geriatric person, the senior person, the one with the wisdom, you know, because y'all some dummies when y'all young, just saying. The purpose of getting her to elevate those ankles was because as we get older, our veins get older. As our veins get older, our valves in our veins get older. What do I mean? Well, there's something called valves and veins. Yeah, it's fancy $4 word, but it's a valve in a vein, and the purpose of the valve in the vein is to prevent the backflow of blood. As you get older, those valves get old, and they do not prevent the backflow of blood, and the backflow of blood looks like swollen ankles when you see it. Okay, so you did all that, okay? That's what you did. You helped your big mama elevate her ankles, work against the valve problem, and work with gravity. That's done. Put that back there. Let's go forward. We got to get on the left side of the heart. We are moving from the lungs through the pulmonary artery. And made that mistake. We are moving from the lungs to the pulmonary vein. Now, why did I really make sure I told you I made a mistake? Or did I really make a mistake? No, I didn't. What I did was point out how easy it is for someone on a test to get the pulmonary artery on the right side mixed up with the pulmonary vein on the left side. You don't want to do that. No, you don't want to do that. See, here's how you got to look at it. The pulmonary artery, which was going into the lungs, is the only artery of the body receiving venous blood. The pulmonary vein on the left side of the heart is the only vein in the body receiving arterial oxygenated blood. Because once you get done in those lungs, you changed your name. Oh yeah, you didn't know you could change your name? It's in the Bible. But so you changed your name. Your name is no longer venous blood. Oh, no. It is no longer deoxygenated blood. Oh, no. It is no longer carbon dioxide rich blood looking for oxygen. No. Now that you picked up that oxygen in those alveoli, in those lungs, you are now considered arterial oxygenated blood. So here we go. We're going on over to the left side. We're coming out the pulmonary vein, and we're moving into, you got it, the left atria. Chilling and filling. Filling with what? Blood. For what reason? To pump it to the ventricles. What is it called in a blood pressure? Diastole. What does it look like on an EKG? It's a P wave. It's the small little hump before the action gets going. Okay, you got that? We good? We good? I just did a little review for your sake. Okay, now we're in the left atria. The blood in the left atria is got a valve to go through. That bicuspid or mitral valve, try it before you buy it, remember that? Okay, so the bicuspid valve or the mitral valve, if you will, the blood moves through there. It is pumped into the ventricles. And let me just say this. The ventricles on this left side of the heart is bigger. The ventricle is much bigger. It's got to be bigger because where the blood goes from the ventricle is not next door to the lungs. No, not like the right side. The ventricle on the right side just had to go next door, pump some blood next door, boom, you're done. Good job. No. This big, huge ventricle on the left side of the body where the pressure is higher and the distance for that blood to go is a lot farther. This has to be bigger. It has to be quite a bit bigger than its other counterpart on the right side because it has to pump blood so forcefully that it gets that blood all the way to the toes and the nose. Okay? I hope you're with me. So over here in the ventricle, remember that? Pumping and bumping and flashlight, woo-hoo, neon light. I'm sorry. Again, flashlight. flashbacks. You know, that's called PTSD in your psych lecture. Some PTSD is good. I had a good time. I'm just saying. Okay, stay focused. Now, the blood went from the left atrium to the left ventricle. The left ventricle has a job to do. It is going to pump this arterial rich oxygen blood to the biggest artery in the body called the aorta. And at that point, your blood pressure would be called systolic. The systolic number, or the top number, is the ventricle pumping that blood to this aorta, and that aorta is the biggest artery in your body. So when you put that blood pressure cuff on that patient's arm, it is put over an artery. Remember that. If you look at the cuff, sometimes it'll say artery. The pressure in that blood and the pressure it takes to push the blood throughout the body. Blood pressure, right? So now you have this big aorta. And this aorta is interesting, y'all, because it comes up off the heart and goes down towards your back, through your thoracic cavity, and even down into your abdomen, and then it branches off into big, huge arteries to supply all your lower half with rich oxygen. It is directly tied to kidney function and everything else. And so when we look at that aorta, we don't want nothing to go wrong with that aorta. We don't want no aortic regurgitation, aortic dissection, aortic aneurysm. All that sound messed up, don't it, y'all? It's crack. We can't have none of that. So you need to focus on the fact that the right side of the heart was venous. The left side is arterial. The right side has no oxygen. The left side has oxygen. This ventricle atria type deal is just the top part of the party in the atria where you're chilling and filling with blood to pump to the basement part of the party with the ventricles where a lot of action is going on. Because when that ventricle pumps, and it has to pump all that blood throughout this entire body, that's called on an EKG a QRS. Woohoo! That's big. That's this big old spike, this crazy looking thing. You know what it is. Now you've got to stay with me. Stay focused. I'll be back. You can go and get a snack. I told you I'd be back.